Hello, this is Health Checks with Dr. Memstic. Today we'll be talking about breast cancer. Research and statistics has shown that the commonest cancer in Nigeria affecting the female gender is breast cancer. But did you know that even the male gender can have breast cancer? Have you heard that before? Okay, come close, let us discuss, and you get to find out that even you as a man, you're at risk of breast cancer. So breast cancer is a disease of the breast in which, like every other cancer, the cells of the breast grows rapidly, abnormally, and then it forms a tumor, it forms a lump. And as the disease progresses, it spreads to affect nearby tissues, nearby organs, and then even the lymph nodes, and that is at the advanced stage of the disease. The cause of breast cancer, the exact cause is unknown. However, there are certain factors, if present, predisposes and puts a person at risk of developing breast cancer. Breast cancer is killing women and is the number one cause of mortality. Previously, we used to say that it was a disease of the older women. So one of the risk factors is age. Studies have shown that as one advances in age, the likelihood of developing breast cancer increases. However, in recent times, we have seen that breast cancer is now occurring in younger women. We have had women who have lost their lives even at their late 20s or late 30s as a result of breast cancer. The exact cause of this is unknown. However, studies have shown that they have inherited a particular kind of gene that makes them at risk of developing breast cancer. And this gene is called BRCA1 and BRCA2. It has been implicated in the early onset of breast cancer in younger women. Also, the change in our lifestyle, the lifestyle changes, has also been implicated in the early onset of breast cancer. One of the non-modifiable risk factors is sex. Being female puts you at risk of developing breast cancer. But don't forget that I said that even the male gender can have breast cancer. Yes, studies have shown that 1% of men are at risk of developing breast cancer. So don't say this information is not for you. Come in here, let us discuss, learn one or two things where you can apply this, and be on the lookout. Another risk factor that we call the non-modifiable risk factor is the family history. If you have a family history of breast cancer, you've had a mother, you've had a daughter, or had a sister, a close auntie, a close relative who has had breast cancer, you are at risk, or that person is at risk of developing breast cancer later in life. That is why you have to be proactive and, put this information to practice. Be on the lookout because there is a family history in your genealogy. Another risk factor is the genetics, which I have spoken about. BRCA1 gene, BRCA2 gene. These genes, some people just inherit or have these genes, and these genes predisposes them, puts them at risk of developing breast cancer. Other risk factors, which are the modifiable risk factors, include your lifestyle factors, physical inactivity. Today it is said that sitting down is the new smoking. Physical inactivity, sedentary lifestyle, you're just sitting down on your desk, 9 to 5 work, or you lie on your bed, you're not moving around, you're not exercising, puts you at a risk of becoming obese. And obesity, especially postmenopausal obesity, is a risk factor for developing breast cancer in women. So you need to get up and be active, be physically active to reduce your risk and likelihood of developing breast cancer. Another lifestyle factor is our diet. These days, our diet is more of, we consume highly processed diets that are rich in saturated fats, all the junky food that puts one at risk of developing breast cancer. Another risk factor, let me pause and ask, can you remember the age you had your first menses? If as a woman you had your first menses before the age of 12, then you are at risk of developing breast cancer. And if as a woman you had your menopause, you attained menopause after 55 years, you are at risk of developing breast cancer, because studies have shown that a prolonged duration of exposure to estrogen. Estrogen is one of the female sex hormones. We have progesterone and estrogen as our sex hormones. So a longer duration of exposure to estrogen, which is early onset of menstruation and the late onset of menopause, that longer puts a woman at risk of developing breast cancer. So it is, if you had your first menses before 12 and menopause attended after 55, it is a risk factor. Another risk factor, women who have never had a child before are more at risk of developing breast cancer. Studies have shown that it is statistically proven. And women who also had their first child after 30 years are more at risk of developing breast cancer compared to the ladies who had their first children or had childbearing before the age of 30 years. So not having a child or late age of childbearing puts one at risk of developing breast cancer. Another risk factor for the development of breast cancer is not breastfeeding your baby. In this era where bottle feed is now the in thing, not just bottle feed, artificial feeds, women are no longer breastfeeding their babies. It is a risk factor. It has been scientifically proven that women who breastfeed, breastfeeding is protective, protects a woman against developing breast cancer. And women who breastfed for a longer duration are less likely to come down with breast cancer compared to a woman who just breastfed her baby for 3 months or 4 months and stopped breastfeeding. And then the number of children that a woman has, the more children you have, the less likelihood you are to come down with breast cancer. Women who have 1 or 2 children are at risk of developing breast cancer. Those are the risk factors for the development of breast cancer. Also, else I forget, postmenopausal women who are on hormone replacement therapy, anyone undergoing hormone replacement therapy that has estrogen as part of it, it puts you at a risk of developing breast cancer. And women who take estrogen containing oral contraceptive pills, family planning methods that is only estrogen, prolonged duration on such form of family planning exposes one and puts one at a risk of developing breast cancer. It's important I mention here that for the fact that you have these risk factors doesn't mean you will have breast cancer. It only means that you should be proactive. It means that you should be on the lookout for any signs or symptoms that may be suggestive of a breast cancer. That is it on this episode. On our next episode, we are going to be talking about the signs and the symptoms you should look out for that point and is suggestive of breast cancer, and the screening methods, how we can diagnose breast cancer, and the treatment methodology for breast cancer. Information is power. Ignorance is not bliss. This information can save a life. As with all forms of cancer, early detection saves life. Don't hoard this information. Like this video, share it to women, share it to everyone, and subscribe to our channel. Stay tuned and stay hooked to Health Checks with Dr. Memstic. Thank you.